Hello, I'm Dr. P. J. Mazumdar from Arogyam Hair Transplant and Cosmetic Surgery Clinic. So today I'll discuss with you hair fall and hair loss causes. What are the causes which bring about hair fall and also the treatment. So I'll just discuss in short the various causes and various treatments. The most common cause is Telogen effluvium. It is called Telogen effluvium. So this is a temporary loss of hair, a temporary fall of hair. Usually it lasts for about 3 months and can continue for 6 months, 9 months or longer as long as the cause is not cured. So in this the hair loss is temporary, the hair will grow back again. But during the period of hair loss, patients tend to get worried because of the amount of hair that they see have fallen and also because they fear that the hair will not come back. But it does always come back. So there are a number of causes of telogen effluvium. So the commonest cause of telogen effluvium is change in environment. So when a person changes his house, goes to a different place, when a person changes his water, they usually notice a temporary loss of hair. They will complain that I've been losing hair a lot since I came to this place. So that occurs due to the change in environment, due to the different food, due to the difference in water. So all these causes lead to a temporary hair fall. But this is always temporary. The hair will grow back again. High fever or any other illness is the second most common cause of telogen effluvium. So when a person develops an illness or has something like a high viral fever, as we have seen in the case of COVID, there is a temporary period of shedding of hair which occurs after about 3 months of the illness. So the person continues to lose hair for about 3 months again, and but after that the hair loss usually stops and it will stop with treatment and then the hair recovers. A third common cause of telogen effluvium is vitamin deficiency. So when a person develops vitamin deficiency, certain vitamins are very important for hair, like biotin, zinc, vitamin D. So all these vitamins help in hair growth. So when there is a deficiency, there is again hair loss. Stress is another common cause of telogen effluvium. So when a person has mental stress, any kind of physical stress, when he develops depression, when he develops anxiety, there will occur a period of hair loss. This is also temporary. When the person recovers from the stress, the hair loss will stop and the loss of hair will recover again. Hormonal imbalances is also another very important cause of telogen effluvium. So when a person has thyroid hormone abnormalities, blood sugar abnormalities, abnormalities in testosterone, when a lady develops high testosterone for example, or low FSH, low LH, all these causes lead to hair loss. So this also is temporary. The hair loss lasts as long as the hormonal deficiency is not corrected. When we correct it with medicines, this hair loss stops and the hair will again recover. The hair will grow back. So there are also many miscellaneous causes of telogen effluvium like high cholesterol, high triglycerides, high urea or creatinine, liver failure, etc. So all these causes which harm the body, which affect the body in different ways, will also affect hair and it can cause hair loss. So this hair loss is also temporary. When the person recovers from that illness, he will regain his hair. He or she will regain his hair. So this is also telogen effluvium and it lasts as long as the illness is there in the body. Another very important cause of hair loss besides telogen effluvium is immune disorders. These are disorders in which the body's own immune system attacks hair follicles. So the commonest cause of this is alopecia areata. So in this there is a loss of hair in a round patch. This is quite common. Many people may have experienced this. The hair loss occurs as a round patch and that is temporary. The hair loss generally recovers well. But sometimes this can progress. the hair loss does not come back and instead the alopecia areata progresses. The person may lose most of the hair on his scalp or on her scalp in a patchy way, and in fact the person may become completely bald and subsequently may even lose hair of the eyebrows, of the body, underarms, hair in all parts of the body. So that is called alopecia universalis. So it is a progressive form of alopecia areata. In alopecia areata there is only a small round patch, but this can progress up to alopecia universalis when there is complete loss of hair. The third group of hair loss causing diseases are called scarring alopecias. Scarring alopecias occur due to a disease in the scalp. So there the white blood cells like lymphocytes or neutrophils attack the hair follicles. It is an inflammatory disease of the scalp and that affects and destroys the hair follicles. So that is treated in a medical way, usually by steroids. The fourth group of hair loss causing diseases is androgenic alopecia. So that is the condition which we commonly know as baldness. So there are two types, male pattern baldness and female pattern baldness. In male pattern baldness, the hair loss occurs in a typical pattern. Usually the front hair starts going, or sometimes a person may start losing hair in the vertex area, and then that progresses to up to grade 7. Female pattern baldness is different in that the lady loses hair all over the scalp uniformly. There is no specific pattern. Instead, there is a thinning of hair throughout the scalp. So, and that is called female pattern baldness, and in males it is called male pattern baldness. So, male pattern or female pattern baldness is generally genetic in origin. It is believed to be genetic in origin, and also it is believed to be related in some way to hormones, specifically to the testosterone hormone. But the exact cause of baldness of male or female pattern baldness is not known. So now we come to the treatment of hair loss. So there are various forms of treatment. There are many different steps of treatment. So I'll describe them to you now. The first step of treatment begins with investigations. We first have to identify the cause of hair loss. So for that we do all the blood tests like vitamin levels, hormone levels, sugar, cholesterol, triglycerides, vitamin D, and all important parameters. Especially the hormones are important for this: thyroid hormones, testosterone, FSH, LH, and sugar. So all these tests will help us to identify the cause. In case of androgenetic alopecia or male or female pattern baldness, the blood tests are expected to be normal. Everything comes as normal, and that is also an indication that it is androgenetic alopecia. And in case it is caused due to any disease, we can find that abnormality and then we treat that abnormality. For example, if there is thyroid hormone abnormality, we treat that by giving thyroid supplements, or we treat blood sugar or high levels of testosterone. In that way, we can treat the cause if we find a definite cause. So the next step of treatment is medicines specific for hair loss. So there are mainly three medicines which we use for this. First is minoxidil. So minoxidil is a vasodilator. It increases the blood flow to the scalp, and in that way it helps the growth of hair. The next medicine is finasteride. So finasteride is a DHT blocker. In male pattern baldness specifically, we find that dihydrotestosterone is believed to be the cause of this. So finasteride blocks the production of DHT, and in that way it helps in male pattern baldness. And the third treatment that we do is vitamins. So we give vitamins like biotin, zinc, etc., which are found nowadays in combination. So these vitamins are also very essential. So these three medicines, Mintop, finasteride only for males, and vitamins. These are the three medicines mainly that we use for hair loss. So the third important treatment for hair loss is PRP. PRP is platelet rich plasma. So in that what we do is we take about 10 ml of your blood and we process it. We process it from 10, so that from 10 ml we get 1 ml of PRP or platelet rich plasma. So PRP has a very high level of growth factors. It is rich in platelets and that releases a large number of growth factors, different types of growth factors. And that 1 ml of PRP is injected into the scalp, into the hair loss areas. So there it promotes hair growth. It is quite effective. We have seen it being effective in both male and female patterns of hair loss, in any kind of telogen effluvium, in case of hair thinning, hair breaking, etc. So it is quite an effective treatment for all causes of hair loss. So the next treatment is laser therapy. So we use low level laser therapy or LLLT that uses infrared lights, infrared lasers, which is available in a sort of helmet like structure, which is placed over the head, and that shines that red infrared laser light onto the scalp. That also promotes hair growth, and that is also quite effective. The next step after this is SMP or scalp micropigmentation. In SMP, what we do is we make small black dots which we tattoo into the scalp. So what that does is it does not replace hair or it does not promote hair growth, but it covers up the bare areas of the scalp. So in that case, when we do this in those people who have been losing hair, whose scalp is showing through their hair, so when we put these small tattoo-like spots on the scalp, it covers up those areas, and then it is a camouflage actually. We cannot see the baldness. It covers up the bald areas. So it is also very effective for those who have already lost hair. The next step of treatment is wigs. So in ladies, both wigs or hair extensions can be used. Wigs are round patches of hair which are used to cover up the front, but ladies can also use hair extensions, which are small strands of hair which are attached to the base of the existing hair. In men, we go for wigs or hair patches. So nowadays, the wig technology has advanced very much, and the latest technologies are used to attach the hair, attach the scalp, attach the wig, like pasting or tape. So these can give a very natural look, and wigs have become very popular nowadays. So the advantages and disadvantages of wigs. So you have to study and see if it works for you, and you can use wigs for your hair loss also. And finally, hair transplant. So hair transplant is considered the gold standard for treatment of hair loss. So in a hair transplant, we use hair from the permanent zone and plant it in the areas which have hair loss. So in ladies, mainly three types of hair transplant are done: eyebrows, hairline lowering, and for female pattern baldness. And in males, mainly male pattern baldness and also beard and mustache loss. So hair transplant is a permanent method of hair treatment, and with this we can overcome all sorts of hair loss. So thank you for watching our video today, our short video. So if you are suffering from hair loss, you can come to Arogyam. We will definitely try to find the cause of hair loss, and we are sure to be able to find a way to treat your hair loss.